you can eat your way to a healthy heart, or you can eat your way to an unhealthy heart. You can eat your way to cardiovascular disease, which is the number one killer in our world today. Which one do you choose? And how do you choose? I'm Dr. Ritamarie Scalzo, and I believe that most diseases can be prevented or reversed, and I'm dedicated to helping people find the root cause solution so they can go from disease and dysfunction into living their healthiest and happiest life possible. So today we're going to be talking about some of the foods and the nutrients and the herbs that help support a healthy heart. And if you've been out there and listened to podcasts and YouTubes and summits and all, you know that there's a lot of controversy about what people should be eating in order to have a healthy heart. I think there's some basic commonalities in between, but there's a lot of disparity all over the place. So I'm not here to argue all that. I'm here to present facts and let you make decisions for yourself. Let's start with the nutrients that are required to have a healthy heart, have healthy arteries, have healthy endothelial function. Basic is we start with things that are anti-inflammatory, because inflammation causes damage to the endothelial lining that can trigger cardiovascular accidents. So let's talk about things that are anti-inflammatory. One of the things that we can talk about related to inflammation is omega-3 fatty acids. So we know that omega-3s and omega-6s need to be in a good balance in order for us to have a balance of inflammation and lack of inflammation. And most people, because they're eating seed oils and they're eating a lot of polyunsaturated oils and foods, even people who have gone to a more plant-based diet are eating a lot of nuts and seeds, which nothing wrong with nuts and seeds, but it's having the right balance of nuts and seeds that we don't throw off the omega-3 and 6 balance. So I think it's important for us to test and see after we look at somebody's diet history to be able to assess, is this person at risk or not? And we can look at the omega ratios and all that. But there have been lots of studies that have verified that when you can supplement in the range of 2 to 3 grams a day of omega-3 fats, that can be protective when people have imbalances in their labs. And for more details about the labs, you can check out a previous episode that we had where I went into detail about all of the labs and how they manifest. So omega-3 fats, super important. Now, does this mean everybody should be taking fish oil? No. It means that people should be eating a balance in their foods of omega-3 and omega-6. Where do we get more omega-3? Well, we get it from the plant kingdom. We get it from flax seeds and chia seeds and hemp seeds and walnuts. These are good sources. Purslane, a wild green edible, very high in that. And then on the animal kingdom, we get that more, not from animals, but from fish, from deep water, clean sources of fish. And of course, the algae, which is what the fish eat. So depending on, you and your client patient's orientation, you can get these from good plant sources and also from the fish kingdom. We do have to be careful when we're getting things from fish because of the mercury and the PCBs and the other contamination. So it's always a balance with foods. It's always a balance. We also need good antioxidants, and we find all those antioxidants in the plant kingdom, in the plant foods, right? So the foods that supply the vitamin C and the polyphenols and a lot of those things that are protective of the cardiovascular system, we need to make sure we do that. And there have been studies that show that people who are supplemented with a lot of vitamin E as a supplement didn't really have improvement. So I like to look at foods as well. So looking at getting people's diets up to speed. And one of my favorite sources of vitamin E is an herb called annatto, A-N-N-A-T-O. And it's this yellow kind of orangey, looks almost like turmeric, and can be added to things. And you're going to get a lot of vitamin E in the form of tocotrienols from that. So lots of ways that we can get this. And we know that we can protect the body from the oxidative stress and protect the endothelial linings when we have adequate doses of these antioxidants. But we also have to think about other antioxidants like glutathione. Now, glutathione you can supplement with glutathione. You can supplement with precursors of glutathione like N-acetylcysteine. And there's foods that contain it. There's avocados, for example, is one of my favorite sources of good glutathione. So checking that out, make sure that people have that. Selenium is another antioxidant and is super important for thyroid function. And thyroid dysfunction can contribute to cardiovascular disease. So selenium is good. Selenium is cool because you can get enough selenium in 2 Brazil nuts to completely meet the RDA, assuming the person has good fat digestion happening. Another super important nutrient for cardiovascular health is magnesium. And we know magnesium is super important for muscle relaxation, muscle contraction relaxation, calcium contract, magnesium relax. And guess what the heart is? It's a muscle, right? So if you're working with somebody and they're telling you about their leg cramps, oftentimes that's a magnesium deficiency, and that can be affecting their heart. So magnesium is super, super important. Most people don't get enough in their diet unless they're really focusing on it. It's really abundant in green leafy vegetables and a lot of the plant foods, but the average American doesn't eat a lot of that stuff. So really looking at dietary and seeing, are we getting enough magnesium here? Are there symptoms of low magnesium? And we can always measure it, but serum magnesium is not the best way to measure. Red blood cell magnesium is better. So potassium is another mineral that is an electrolyte, and it's super important for contractility of the heart and for muscle function in the heart and relaxing the blood vessels, right? We need relaxed blood vessels so we don't have that constriction, which can lead to a heart attack or stroke. So magnesium and potassium work well together. Potassium's a little harder to get if someone's on a low glycemic diet. For example, like we're used to potatoes and bananas being really good sources of potassium. So I find that sometimes when people start to adapt a more keto approach or a low glycemic approach, and they eliminate some of those foods, that they start to get leg cramps, and we think it's magnesium. Supplement with magnesium, it doesn't work. It's actually potassium. So these work hand in hand, and we have to look at this. Soluble fiber is important. It helps to pull the cholesterol out of the system, right? The cholesterol gets pulled through the liver and it's put through the bile ducts into the intestine, and it's there to help carry away a lot of the toxicity. And when we have a problem with the lack of fiber, when we're not eliminating properly, that cholesterol just keeps getting recycled, and it causes high levels of cholesterol, which contribute to heart disease, but also higher levels of toxicity. So the fiber is super, super important. Niacin can be super helpful for lowering lipoprotein little a, for helping to dilate the vessels. It's a very potent vasodilator. But you've got to be careful with niacin supplementation in very large doses, which is what the studies show. And some people, it can have an adverse effect, like raising homocysteine and elevating blood sugar. So we'll have a whole nother episode where we'll go into the details on that. So there's a lot of research on garlic, and a lot of people, don't want to take a lot of garlic, or the amount that they need to take for cardiovascular health, because it stinks, right? It makes their breath stink, and they get complaints from their family members. But garlic is very potent, and there's garlic supplement. You can buy aged garlic, like a supplement like Kyolic, or you can make your own fermented black garlic, which is really fun and delicious to eat and has been shown to have very good cardiovascular and antioxidant. It's turmeric, good old turmeric, right? Turmeric has been the wonder herb these days, and turmeric is a potent antioxidant. It's a potent liver detox herb, and has been found to be very helpful in a lot of different ways. So it's a good anti-inflammatory. It helps to bring down the inflammation inside the artery walls. Ginger is another one. Delicious condiment. You can add it to everything, and it's very helpful for bringing down inflammation. Cayenne pepper, excellent as a vasodilator, actually. It opens up the vessels, and it's been used a lot in diabetes for the neuropathies, and creams that you put on. It gets everything to dilate, but it's very helpful to improving circulation. Ginkgo biloba. It is a vasodilator. It opens up circulation, especially to the brain. It's been studied in helping to bring down lipoprotein little a. in large enough doses, it can do that. You have to be careful about people who have a tendency to vascular type headaches, because when it opens up the circulation to the brain, it may affect that. So I would go low and slow. Green tea has a lot of antioxidant properties, and it's been shown to be good for stimulating the circulation, helping to lower cholesterol levels. You'd have to test it out on individual people. Improves the vessel function, right? The function of the vessels is to expand to contract as we need it, and then reduce the risk of heart attacks or strokes. Motherwort is another one. It's used a lot in thyroid and hyperthyroid, but it helps to tonify the heart. It helps to lower blood pressure. Inadvertently, it can help to lower the risk of heart disease. So these are all things, if you're going to use any of these that are more therapeutic versus culinary, I would highly recommend that you research them and make sure that it fits well with the person that you're working with, and that it's not contraindicated for medications or other supplements or other things that they're on. There's a lot here that you can do. This is just an introduction. We'll be doing a whole 2-day event on this. We did a 3-day event on this cardiovascular system for our practitioners at our conference called Shine. Check the show notes and we'll show you how you can get access to the recordings of that. 3 days of amazing information all about the cardiovascular system and the genetics and the lab testing and the foods and the supplements. So I highly recommend that you check that out. I'm dedicated to teaching practitioners to take charge of their clients' health, to help their clients to take charge of their health, and to learn everything you can. So check out our nutritional endocrinology program at inemethod.com. So I thank you so much for being here. And until next time, shine on.